Bill Farmer Jr., who's here. Thank you. You've been very faithful to these press conferences. And this morning, we have several people who are here in case you have any questions, including our Health Commissioner, Dr. Craig Humbaugh. Thank you, Craig, for coming. And Dr. Humbaugh has announced that we have had another death in Fayette County this morning to the coronavirus, bringing our total here in Fayette County to 7. I also want to welcome Ray Daniels, who is here today representing our business community as chair of the Commerce Lexington Board. Thank you, Ray. Today, we are issuing a call to action to our local businesses who can help produce the supplies the city and state desperately need to respond to the COVID-19 pandemic. I want to thank the dozens of businesses that have already stepped forward. We do still need more help, especially in the production of personal protective equipment, or PPE, and ventilators. These are critical weeks ahead of us when the demand for PPE is going to climb along with the number of cases. Now is the time for every citizen to think about how he or she can be of most help. Ray, can you tell us a little bit about Commerce Lexington and how it is helping? Ray Daniels.
Thank you, Mayor. Good morning. I'm Ray Daniels, and I'm pleased to be here today representing Commerce Lexington. Today, Mayor Gorton and I are calling upon our local business community to help us with supplies we need to get through this crisis. We have already heard from many generous corporate citizens, but this is a time when we need all hands on deck. Although we are forced to be apart, this crisis requires all of us working together. Members of the business community, we need your continued leadership in ensuring our community of doctors, nurses, and healthcare workers have the supplies that they need. Take a look at the PPE supplies that you may already have and your capacity to shift production to the equipment our city and your state so clearly need. And just as I'm asking businesses for their help, I'm also asking the citizens of Lexington for their help in any way they can to help us move through these difficult days. We all have to help one another. Contact Lex has a call number of 311, and someone from the Emergency Operations Center will help follow up on any leads that you may have pertaining to the PPEs. Commerce Lexington is working to help people who have lost their jobs by establishing a job bank on its website, by helping businesses deal with the small business disaster loan process, and with information about unemployment insurance. We're also urging citizens to support local businesses on a daily basis. Commerce Lexington continues to lead and want to be your resource for the business community. Any questions, or if you'd like to look at our website, it's commercelexington.com. Thank you, Mayor, for all that you're doing to lead our city through this crisis. And I will leave you with this, just as we're getting through this together, we will all help our businesses recover together. Thank you, Mayor.
Yes, we will. Thank you very much, Ray. So I have been holding weekly meetings with representatives of our healthcare community, including our hospitals. Like hospitals all around the country, our healthcare community's supply of PPE, gloves, masks, Tyvek suits is running low. We need this help from businesses that can produce these products or have a stockpile of these items they can donate. Our healthcare workers are among the heroes of this crisis. They deserve to be protected as they go about their daily work. If you can help, Ray mentioned calling 311. Also, you can call the mayor's office at 258-3100. That's 859-258-3100. We all need to put our oars in the water and paddle this boat to make progress together. I am fighting for Lexington. That's my job every day, but it has never been more important than it is right now. Now it's a matter, literally, of life and death. And I'm going to do every single thing I can to save lives in our community. Joining officials from around the state, we're fighting this with everything we have, and that means sacrifices from all of us. We all need to remember that every time we stay healthy at home, or stay 6 feet away from the person next to us, or wash our hands, every time we do these things, we are helping save lives. Now, for a couple of other updates. First, a reminder about yard waste. The city will provide curbside residential yard waste pickup to its waste management customers one time in April. On April the 8th, that's this Wednesday, crews will pick up yard waste for everyone who has city garbage pickup on Mondays and Tuesdays. Next Wednesday, April 15th, crews will pick up yard waste for everyone who has city garbage pickup on Thursdays and Fridays. Finally, I want to thank everyone for paying more attention to social distancing as you enjoyed our parks this past weekend. It was a beautiful spring weekend, and even so, you did a good job with social distancing. Remember, you can walk or jog in our parks. Just please don't do it in groups. Stay 6 feet apart. I want to thank everyone for contributing to the success to overcome this virus. Now, if you have any questions, we will take them now. Thank you.
Yes, you mentioned that you have been meeting with kind of hospital people weekly. Could you tell me how quickly they're going through this PPE on a daily or perhaps weekly basis?
I don't know, Dr. Humbaugh, if you have any insight into that. I started my conference calls quite a while back with all of the healthcare providers, and they have reassured us that this is their greatest need right now. I don't know numbers, how many they go through each day. Do you have any insight into that? It's difficult to understand without the numbers. Dr. Humbaugh?
Thank you, Mayor. We have a lot of healthcare providers in the city, and it is difficult to keep track of that. But I will say that from our state and national caches, so far we have distributed over 284,000 surgical masks, over 70,000 N95 respirators, and around 2,000 boxes of gloves.
Did that help? Mm-hmm. What other questions do you have?
Madam Mayor, which businesses, any specific that you're calling upon right now?
We are asking any business to look at whether in their course of natural work they have PPE. Many of them have to protect themselves with masks or gowns. So any kind of business that might have this stockpiled, we are asking them to look at what they have and what they might be willing to donate. We also have businesses that are turning around their production. They used to make one thing and now they're producing different types of PPE. So we're asking any business to just do some critical thinking about what you have, what you might donate, or whether you can turn your production to making some of this. And if you can, we can connect them with the specifications that are needed.
So this is in anticipation of worst case scenario, we're not in a critical situation just yet.
Well, this is in anticipation. As you know, the Nutter Center at the University of Kentucky is standing up a field hospital for 400 beds. There are other facilities getting stood up across the state, and they will need the PPE. All the health experts, local, state, and federal, believe that the next 2 weeks are going to be, cases are going to increase. And so the need will be high at that time. What other questions?
Mayor, do you have a sense yet on current year budget deficits during your two main revenue sources of it?
So the question is, do I have a sense of current year revenue deficit? Given that Fayette County is heavily dependent on occupational license fee, which is basically the local income tax, and the business net profits tax, we do believe it will be a revenue decline of several $1 million between now and June 30th.
Have you already instituted any sort of spending freezes? Do you anticipate furloughs?
The question is, have I instituted any spending decreases? We encumbered all monies in order to get a handle on expenditures. We have a hard hiring freeze in place. We did that. We did these things probably 2 weeks ago, or maybe 3. Everybody's kind of in a time warp here. And so we have taken some steps to ensure that we are not spending and that we are not hiring, and we daily look at our revenues. We don't have our revenues in yet for the first quarter, or where are we here? The third quarter of this fiscal year, but we will have those in several days.
Is any of that spending freezes in areas that the public would notice immediately?
No, the question is, does any of that spending freeze impact things that the public will notice? No, it does not. We continue to have our public safety folks on the job. Our waste management folks are picking up garbage and recycle. And as you just heard, we'll do 1 yard waste in April. And we have some traffic engineers who are keeping the lights going, and revenue is working. There are certain folks who can't stop working because you cannot do revenue from home. Things like that continue to keep us operating. Our enterprise solution folks who are payroll, HR kinds of functions, they continue to operate. So any kind of permitting or paying of revenue, we have instituted methods that do not involve in-person contact. So we put all that into place about 3 weeks ago, and it will help us get through this fiscal year.
Do you have an idea on when you're going to know what your current year budget deficit will be? Will it be a couple of weeks before you give your budget address?
The current fiscal 20. The question is, when will I know what the impact is on our revenues for sure? And of course, all along the way, we've been in contact with our forecasting teams at UK, in Louisville, at the state, and at the national level. And so we will not know the impact for a week or two on our third quarter. Our third quarter, which included January, February, and March, I believe should be fairly healthy. It's the fourth quarter that will be the difficult part. What other questions?
Dr. Humbaugh, we had seen in the last couple of days, there's only been single-digit increases in here in Fayette County in terms of new cases. Is that a positive sign, or is it too early to say?
So Dr. Humbaugh's question is, we've seen single-digit increases in, you are referencing the deaths.
No, the new cases.
The new cases, excuse me, the new cases. Yes, and what does that indicate?
Well, thanks for that question. I do think it is too early to tell, so a couple of days do not make a trend, but we will be watching that and seeing what happens. It does seem that we are seeing some curves, so some increases, then we'll see less numbers for a few days and then increases again. We're hopeful that the social distancing that everyone's doing, the physical distancing that is taking place is going to have an eventual effect in flattening the curve and slowing the progress of the disease.
Doctor, what are your thoughts on chloroquine that the president seems to be pushing?
Yeah. At this point, I think that scientists are trying all different types of potential remedies, especially for those who are very seriously affected by COVID-19. And so we're seeing not just chloroquine, but other types of drugs that we might normally use for other types of viruses, and even steroids being employed as possible remedies for folks. And as time goes on, I think we'll know better about whether those are effective or not. But at this point, I think many people think, how does that necessarily hurt to try and see what is potentially effective? Yeah.
Are there any other questions? All right, thank you all so much. Appreciate it.